family, welcome to the Sistashanice Show channel. If you're passing by for the first time, hey, don't be a stranger. Please do subscribe, hit the notification bell so that you know when videos are being dropped on this channel. Please do also give us a thumbs up. Welcome. Now today's show is going to be about the Jamaica electronic health record contract that has been awarded to a company called TPP. TPP was awarded the contract that was worth over £5 million, and it's to help Jamaica integrate an electronic health record system. Now, this TPP contract operates across 13 healthcare services sectors in Jamaica and forms part of a pilot project that is about integrating health records. It's a new program. What does this integrated health record system mean? What this TPP contract actually does, it also gives the company access to all of the medical records information for Jamaican patients. And so, as we all know, healthcare data is very sensitive information. And so you need to be mindful who has access to your healthcare data. So who's the owner of TPP? Well, the owner of TPP is none other than Frank Hester. Does the name sound familiar to you? Well, it certainly should, because Frank Hester is the same man who made some really awful racist comments about all black women and Diane Abbott. He said looking at her makes him want to hate all black women, and that Diane Abbott should be shot. This is the owner of TPP who has won this £5 million contract for Jamaican health records and has access to the health records of not just Jamaican women, but Jamaican children, men, elders, everybody. He is also the biggest donor to the Conservative Party, donated about £10 million last year to the UK Conservative Party. He has an OBE and is very highly regarded in the UK, but despite his racist remarks and the outrage that came as a result of those remarks, he refused to apologise for racism. He said that the comments were rude, but failed to acknowledge that these comments were racist and sexist, and has refused to apologise for those really awful utterances. So one of the questions I think Jamaicans need to be asking is, why are they allowing the health records of their citizens to be in the hands of a company with an owner who has openly made such racist and sexist remarks? This should be so concerning. Health records need to be treated as a matter of national security. We should be asking ourselves, can the health records of black women and black people generally in Jamaica be safe and trusted in the hands of someone who has expressed such racist open remarks? Why should anyone with such overt racist views and tendencies really be allowed to access such sensitive information? You know, information about the health of black women. You know, should his utterances not be taken as a warning? You know, it makes me as a black woman ask, what about the safety of us as black women? Who cares about our safety? What protection mechanisms are being put in place to ensure that as a people we are safe and our health records are in the hands of people who genuinely care and are not, you know, racist or sexist in any way? You know, how can he be trusted with such sensitive information and such sensitive data? You know, can we have the confidence that as a black woman, you know, these records are under his safe watch? You know, what we do know about the company, that in recent years there have already been at least 2 very serious breaches that have been reported about. The first serious breach was in 2017 when there were compliance concerns that affected about 2,700 general practitioner GPs in the UK. And this was a breach concerning data sharing of people's medical records linked to some software malfunctioning. And then there was a second breach, and this breach affected the data of about 150,000 patients. These were patients who had opted for their data records not to be shared with any companies outside, of their own personal GP. But TPP, for at least 150,000 of them, allowed their data to be shared and to be exposed. Now, obviously, they offered their unreserved apologies for these breaches, but nevertheless, it just goes to show, does it not, the weakness in the system that they're operating. I mean, what we as Africans and Black people need to be aware of is that our melanin is special. We are melanated people, and, we have the biochemical matter for life itself. And so our great elder, Dr. Layla Africa, he told us that our melanin is being studied more by the military in the US than any other institution in the world. Does that not raise some eyebrows and some causes for concern? How can we be sure that TPP, for example, is not going to be sharing the data information with such institutions? And, why would such institutions want people's health information and be studying melanin to the extent that it is? So are there not lessons that we can learn from history here? Surely we're not that stupid and blinded to the advances in technology these days and biotechnology and biological chemical warfare to not be able to put two and two together and be concerned about where health records could potentially end up. Why would a country like TPP want the healthcare information for the women and people in a country like Jamaica? We ought to be aware of these various agendas that are out there as well. So what concerns me is that there are so many of our African and Caribbean leaders who do not see, the enormous responsibility that they have to protect the healthcare data of their citizens, and don't seem to be able to see beyond a contract and the potential implications that a contract may have, and why some data should not go outside of the country at all, but should be held in the country for a matter of national security. An example came to mind, and excuse me if you think it's a flippant one, but the situation for me regarding Jamaican women's healthcare data being in the hands of a company like TPP, where the owner has openly expressed his racism and refuses to apologise, reminds me of the campaign that we've got going on here in the UK for reparations, and where the country, and the MPs sitting in Parliament, those who are the descendants of the ancestors who enslaved us and who enriched themselves off of our blood, sweat and tears, are refusing to apologise for our enslavement. But we take our records and put it back into their hands. It's like, the asking the Holocaust victims to put the medical records of the survivors, the descendants of those survivors, into the hands of Hitler or Hitler's descendants. I mean, it's ludicrous. You just wouldn't do it. So why do we do it? What's the matter with us as a people? You know, and it's not as if there isn't cause for concern about black people in the healthcare system, even in the UK, much less in Jamaica now, you know, because as we know, black women are 4 to 5 times more likely to die giving birth to children in the UK than any other race. What's going on? Nobody knows what's going on. There's been no proper investigation or analysis to find out why it is in something as natural as childbirth that more black women are actually dying than any other race. What's going on? So, you know, all of this ought to be cause for concern. The advances in technology, medical inequalities, the history of the medical inequalities that exist. You know, look to places like South Africa in terms of their health and what's happening there. Look to the women in Ethiopia who, you know, wanted to go to Israel, what was happening to them there. There are so many examples of racial inequality in the health sector and where we as a people have been targeted. So we need to be careful about who has access to our healthcare records, and it needs to be treated as a matter of national security. And knowing how special our melanin is, knowing that there are institutions out there that are studying our melanin, and knowing, you know, the advances in terms of agriculture and the medical industry, etc., you know, why we ought to be concerned as a people, knowing that our records should be treated as a matter of national security and is not, leaves me very, very concerned indeed. Am I worrying needlessly? Just so you know, we are not alone with our concerns. The National Health Service in the UK, their unions are actually calling for Frank Hester to lose the NHS contracts that he has with them because of the racist remarks that he has made. They are concerned that he is responsible for so many contracts involving the records of black people in the UK, women in the UK, knowing that he holds these sorts of racist views. And in the UK, he has actually managed to secure no less than about £400 million of contracts. So a lot of concern here about his openly racist remarks, and also about the sensitivity of the data that his company has access to. So let's do the right thing, family. Let's make sure that the people who manage the contracts concerning us as a people are more likely to have our interests at heart. And if they've openly said, you know, that they, you know, for some trivial reason want to hate us all, we need to know that this is an alarm bell that's been rung. Anyway, let me know your thoughts and opinions. Sister Shanice, out of here for now.